Hey friends, just wanted to come out here to Lake Louise and give you guys a great update. I had an appointment with my possible surgeon yesterday. And after they rescheduled me a couple times, we were able to get in. So 2:45 they moved my appointments up to, so I was able to meet with Dr. LeBlanc. So this is Dr. Michelle LeBlanc, and she is super cool, very nice. At first she opened up with the, at stage 4 cancer, they don't often do surgery. This was something they always thought would end up putting people kind of in the grave sooner, or it just wasn't going to promote longevity. So she started with that, but then she said, but the recent research is showing that it's important to give these people a chance. And if you can do the surgery, if the patient's healthy and they've gone through the chemo and they've done all the things and it was responsive, that the surgery can be a really good benefit and is showing to help reduce the possibilities of recurrence, as well as just, take off the tumor burden. So it's more than just getting a surgery, it's more than just taking off the tumor. There's a lot of things to think about when you're doing this surgery, and she was really great about explaining her concerns and what she would want to do. So, after she took a look at my tumor, which was just injected on Monday, so I told her it's a little puffier than normal. Usually it's a little flatter, but it's a little puffier because it's full of mistletoe, which I did castor oil and I did Indian clubs, and I was doing qigong and a bunch of arm pumping movements to try to move the lymphatic tissue over here and get some of that mistletoe moved out of the tumor, which actually I did a great job. I think it reduced quite well. But I told her that it's a little bit larger than usual, and she still thinks it's a little close to the skin. So she would like me to finish the rounds of chemo that Dr. Rob had recommended. So I'm not sure where that puts me, if that puts me wrapping up in July, like the 16th, right before my birthday on the 18th, or if that puts me, mid-August. So it's going to come down to the tumor size and how I'm dealing with treatment. So Dr. Rob is on vacation right now, so they had a little trouble getting all of my documents, which, I told them I have everything. So I kept all of my documents. So I'll be going onto their portal and uploading a couple pieces of paperwork that I think she might have been missing. But also, I even offered to drop off the discs because they couldn't get them from the first imaging center quite yet. They probably will, but if they don't, this is a really good example of why it's important to keep your own medical documents. I have a whole binder for this journey. Honestly, it's like 1.5 inches. It needs to be like a 3-inch binder now because I have so much research I've put in there, and all of my labs, all of the phone conversations I've had with people. I've written everything down, and I just have a really master binder on my experience through cancer. So it's helpful because I could bring it over to her and she can make a better decision, but it appears that she would highly recommend I finish through with the chemo since I'm handling it so well and I am getting a great response with my tumor. And then, then she would consider doing surgery, which is awesome. So she is open to it. She's also open to doing the double mastectomy. She thinks it's better to do kind of them both at the same time. And she was talking about some scar lines, like all the details of surgery, we'll have to hammer out toward the end or a little closer, but she has moved toward doing the scar lines where it follows your pec muscle. So they kind of blend and hide under the pec tissue, which I would have to build up so I don't look like just a rib cage. But she said because of the placement of my tumor being kind of on this upper left corner, she might have to take that skin, because giving me a surgery but leaving some skin that's already been seeded with cancer cells isn't going to do me any good and might actually make things a lot worse. So she would take a pretty good portion of that skin away, and I think that she mentioned it would mean that I would have more of like that diagonal kind of look. If you guys have never seen what it looks like and you're curious on this stuff, there's a great website. I had forgotten the name of it before, but it's called Not Putting on a Shirt. I believe it's .com. Careful with that. But I think it's notputtingonashirt.com. And they have a great resource for surgeons that do aesthetic close, flat closure, which is what I'm looking at. And LeBlanc does do that. You do want to find a surgeon who does that type of surgery. So you can take a look and see what these surgeries kind of look like. But, my goal is to not have a bunch of like breast tissue stuck under there that's like bumpy and weird looking. Like, I don't want that. I want a nice flat closure. And she said I don't have a ton of skin, in between. I'm not super overweight, so she might not need to tie it like a knot, like some people's come in the middle there. She doesn't think she'd need to do that with mine, which is cool. I don't want like a big bump in the middle. Anyway, positive consult for sure. She seemed definitely open to it. I think she was very professional. I had a great meeting. She was able to joke with us, which was really great. We did talk seriously about this, my chances and everything. I think the scariest thing moving forward now is going to be how many lymph nodes are affected and how many will she have to remove. So the positive thing she said about doing chemo is that often it clears out the lymph nodes fairly well, so you don't as often need as many taken out. She mentioned them as sort of like a level 1, 2, and 3, kind of getting deeper into the axilla. So a real, tough part of healing would be if she has to do a deep dissection into my axilla, which if you guys have ever looked at the brachial plexus in there, it's a mess. It's a lot of stuff going on. So I really don't want them to have to take it all out. I think the sentinel lymph node, which is the one that really it's like the first one that swells up when the cancer has gone into the lymph nodes, called the sentinel. I think that one needs to go. She could feel a couple in there, but nothing too insane, especially because they used to be really swollen. So she was really excited about hearing that they had shrunk down. So that's a really good sign. She also said she would be willing to do dissections of the lymph node in surgery so that they can test it to see, hey, is there cancer in here? If there is, they're going to keep taking lymph nodes and testing. And then if they get one that they're like, there's no cancer in here, there's no need to go further, they'll stop dissecting deeper. So it's not often done, but it can be done where they can check these lymph nodes as they're doing it. It does take time, she said. It's not the best of situations, but when we're trying to minimize, the amount of damage that we're causing and hopefully, avoid the lymphedema, then this kind of thing, I think this kind of thing makes a lot of sense. So I did say I would prefer if she tried to test them during the surgery, because I really want the minimal amount taken out. And I even mentioned, does it even make sense to have to go crazy into the lymph nodes? I mean, the cancer's already been in my body, so technically it's probably seated other places and you can't take all the lymph nodes. But she understood where I was coming from with that, which was good. But she, just said it's the same idea as the tumor. When these things get scarred down, they can have little pockets where it can hide. So I do think some of the first level lymph nodes, maybe the second, need to go. Just really hoping I don't have a lot of swelling and residual issue in my left arm because of this. But I do feel like I have a really good surgeon to be able to help navigate me through that and hopefully avoid all those side effects. So yeah, that's my big update. It's Friday, and I'm going to go into this weekend feeling positive. I had a feeling they would make me go through the rest of the chemo anyway, so hopefully I'll be done in July. I do think, the tumor is going to be non-existent in August, but hopefully small enough in July when, at that point, I'll get the okay from Rob. We'll go see LeBlanc again. She's going to I agreed that she can order a breast MRI, which I really didn't want at first, and the reason being is because gadolinium is a contrast they have to use in breast MRIs, and I asked if they could do it without the gadolinium, and she doesn't think it's worth it. It's kind of like, it's not going to really show enough without the gadolinium. Gadolinium can have a lot of side effects in people. There's a lot of neurological, it's basically a neurotoxin is from what I understand of it. Without having recently looked any of this up, I just know the body doesn't handle it great. So I really didn't want to do it. But if she's willing to work with me, I'm willing to work with her. So if she needs a breast MRI, fine, breast MRI it is. If that helps her decide how much skin is affected and how many lymph nodes may be affected, then seems worth it to me. So yeah, I mean, I'm super optimistic that this is going in the right direction, and I can hopefully get this surgery in Asheville and I don't have to travel around finding a surgeon. But you know, like Sarah had said, we might want to just keep our options open and still do a little shopping around, because nothing is set in stone. There is no absolute right now. So either way, we may have to shop around, but this weekend, I think it's a celebration. I think I'll crack open a hop water. I don't know. Maybe do a little celebrating. I don't know what that means. Probably just hanging out in my yard in the morning, because it's supposed to be really hot in the afternoons here. So I'll probably be inside doing some paperwork stuff. And I got a massage this weekend, actually. I have a massage with an old friend, so this is exciting. I have a good weekend planned. I hope you guys all have a wonderful weekend planned. And thank you for checking in with me. I'll talk to you all soon.